Hi, I'm Dr. Srikanta J T, consultant, Paediatric Interventional Pulmonology and Sleep Medicine, Aster CMI Hospital, Bangalore. Today I'm going to discuss about treatment in asthma. So a lot of patients come to us with lot of suspensions, lot of tablets and lot of nebulizations and ask us, this is a file that we have and we've been giving and only giving medications and child is not getting better. So please tell us, how do we move forward? What is the right way of moving forward? And most importantly, what is the right medication and right dose with right technique? So there comes treatment of asthma. So treatment of asthma worldwide and gold standard is always been inhalers. See, when we talk about asthma, say in 1940s, 1950s, patient would come with acute exacerbation and there are only handful of hospitals in Bangalore which would treat asthma, and the treatment would be adrenaline injection and oral steroids. But now treatment of asthma has gone leaps and bounds, and we are talking about quality of life, we are talking about having absolute zero side effects to minimal side effects, and that is where inhaler comes in. So inhalers are considered as gold standard in treatment of asthma. Reason being, when we consider tablets and suspensions to inhalers as well as nebulizations, tablets and suspensions are in milligrams. Nebulizations also in milligrams, whereas inhaler are in micrograms. So already you are giving 1/20th or 1/30th of the dose that you are going to give with tablets and suspensions and nebulizations. Tablet suspensions and nebulizations work only after 30 to 45 minutes, whereas inhaler works within 30 seconds. Tablet suspensions and nebulizations, because it gets into your blood, side effects are also equivalent, whereas inhalers, because they are delivered with spacer and mask accordingly, so chances of oral deposition is less than 1%, and that getting into your blood is also extremely low, and causing systemic side effects is almost to none. So there you go, systemic side effects are almost to none. And what else as a parent do you want? And most importantly, what we also need to understand is tablet suspensions cannot be given for years. Inhalers can be given for years together, 10 years, 20 years, and without having many side effects. And what people need to understand, and people have to be very, very confident, is we are giving medicines. We are not giving drugs. We are not giving addictive medications. These are medicines. It is similar to what we use for diabetes. Diabetes is a chronic metabolic disorder. Similarly, asthma is a chronic respiratory disorder. If you come to us with an intent of prevention, we will definitely help you out with prevention. But intention of cure is not something that can be done in asthma. It is similar to diabetes. You control, you prevent, you have a very good quality of life. And that is what is asthma is. And most importantly, when it comes to medication, inhaler does control, inhaler does prevention. And of important note is, you'll be given two inhalers. One will be a rescue medication which will be given as and when required. Imagine your child has acutely wheezing now. Do you have to give him the blue color one or the green color one? Yes. Please go ahead and give it. You don't need anybody's permission to give it, and start it and continue it for 2 to 3 days depending on your child's symptoms. But the other one, which is of different colors, it can be pink color, it can be green color, it can be brown color, will be decided by us. They are called as preventers. Preventers have to be used for a certain period of time. That certain period of time is usually between 6 weeks to 3 months. In 3 months, eventually, if your child is doing well, we are going to reduce the medication and we are going to sustain with a reduced dose without having any side effects, without having any complications, and importantly, no addiction. So treatment of asthma is very simple. The only thing that we have to do is spend some time with you guys to make you understand why we are doing it and how it helps your children. And most importantly, if you just do that and convey this, I think you also will be acceptable. And most importantly, you will do what is absolutely right for your child, that is quality of life. Thank you. And for all these things, please do visit Aster CMI hospitals and you'll get appropriate numbers depending on them. Please call for an appointment. Come visit us anytime.